Welcome to Free Your Mind, the One Door podcast that comes out quarterly. My name's Djuna Hallsworth. I'm a peer support leader with One Door, and I'm here today with Sarah Cox and Joe Borger. Welcome to you both. Before we get into any questions, though, I would just like to acknowledge the traditional custodians of the land on which we are virtually meeting today, and to pay my respects to elders past and present. I would like to express my gratitude that we share this land today, and I'd like to express sorrow for the cost of that sharing. I hope that in the spirit of reconciliation, we can move forward to a place of justice, healing, and partnerships as we walk gently on this land. And I would also like to acknowledge all people with a lived experience of mental illness as we walk together towards a world in which people with these experiences are valued and treated as equals. So again, welcome Sarah and Joe. Thank you so much for being here. Would you like to take a moment to introduce yourself? Maybe a little bit about your work, but also a little bit about you as a person. What do you enjoy? What do you do in your spare time?
Thanks, Djuna. My name's Sarah Cox. I'm a clinical psychologist and I manage the Butterfly National Helpline. We provide a range of different services to support people with either a lived experience of eating disorders, eating challenges, or body image issues, or also their carers or other professionals or anyone in the community. I'm very passionate about breaking down stigma and really helping encourage early help seeking, because we know that that can help prevent some of the toll that mental illnesses can take. In my personal time, I like to roller skate, love to see my friends, spend time with my family. And I guess luckily, my biggest passion in life is psychology and mental health. So I also spend a lot of my time outside of work just reading and continuing to deepen my knowledge in that space.
So, hi everyone. I am Johanna Borger. I am the lived experience rep. I recovered from anorexia in my early 20s. I'm now 29. I live in Melbourne and work in marketing for a bank. And in my free time, I love tennis. It's a new obsession, but really enjoying it. Terrible at it, but still really love it. I also do a bit of rollerblading, so I feel like Sarah and I should get together and have a little skate off maybe.
Definitely.
And yeah, I think just at the moment, I'm really enjoying exploring a new city, finding out the best places to grab a coffee, some food, the galleries around the place as well. So yeah, that's me.
Gosh, what are the odds of having two interviewees that are both into roller skating or
Both on wheels.
rollerblading? Yeah, that's amazing. I'm sorry I mispronounced your surname as well, Joe.
No, don't worry. It happens all the time. If anything, blame my Dutch ancestors.
Okay. Yes, thank you so much for taking this time to chat with us about your professional and personal experience. Maybe the best place to start would be with a definition of an eating disorder from perhaps the clinical perspective to start with, and then maybe considering a little more about what that can feel like or how that can manifest from a personal perspective. So Sarah, are you able to tell us a bit about how we can understand this concept of an eating disorder?
Yeah, sure. And look, you probably see slightly different definitions around there, but essentially eating disorders are serious mental health conditions, and they involve significant challenges and also distress and impairment around food and eating. Most of eating disorders also involve some of those things around body weight, shape, or size as well. But there are different kinds of eating disorders, and so each kind of eating disorder does have a bit of a unique symptom profile. And so I guess the common factor across them all, though, is that they do involve thoughts, beliefs, behaviors, and feelings that can make it really hard for people to have a healthy relationship with food and eating. And then that can drive not only a whole range of psychological consequences, but a lot of medical and health consequences as well. So there can be some really serious and even life-threatening effects on the person, which really can affect their quality of life, their ability to function and engage in the different areas that would make up a kind of full life. But then there's also a really big toll on families, the people who love and care for them, as well as the community. There's a lot of absenteeism for people who are experiencing an eating disorder, as well as, say, their loved ones who are maybe helping to take them to appointments or helping to with that care process. So there's also a really big economic cost for the whole community as well.
Yeah, thank you for clarifying that for us. Jo, would you be able to add anything about your personal experience with an eating disorder?
Yeah, I suppose going back to your original question, which is what is the definition of an eating disorder? I think what's been really interesting, having gone through recovery, is that at the beginning of my journey, I had a very narrow view of what an eating disorder was. And I think a lot of people, when they think of an eating disorder, they think of someone who's very thin. It's very obvious, and it's quite easy. Well, it's quite a physical disorder. But when you go through recovery, a large part of recovery is just learning about the different information and the different research that's gone into eating disorders. And it really is just about, from my perspective, I think it's about how you view your body and your self-worth as well. That how you view yourself, how you hold yourself, what you think about yourself. That's such a massive part of an eating disorder. And yes, I think people can have a very narrow view of what an eating disorder is, but yeah, it's a lot more complex than I think most people see.
Yeah, absolutely. And in fact, there seems to be a little bit of confusion around how to categorize an eating disorder and whether or not it actually is considered a mental illness. Would you be able to speak to that point, Sarah?
Interesting. Look, it definitely is a mental illness. There's a very, a huge part of it is the psychological component around thinking, belief systems, behavior, emotions, feelings. But then I think what then makes it even more complicated is that there is that really strong intersection between a medical condition and the medical complications and risks that go along with it as well. So I would say it's an intersection in those space, and ideally, I think we really want people to be engaging multidisciplinary care, because a psychologist alone is not usually going to be equipped to manage all of those areas. A doctor alone is not usually going to be equipped. A dietitian alone, a nurse alone, and even the value of peer support and learning with and learning from people who have that lived experience. So because of the complexity and that intersection, we really want that holistic approach can help get the best outcomes for people.
And does that vary much from condition to condition? So would you be able to maybe outline some of the differences between different manifestations or different categories of eating disorder as well?
Yeah, so there is probably one of the most widely used diagnostic tools is the DSM-5. So in the DSM-5, there's around 8 different diagnostic categories, but we know that people are people. We don't fit neatly into boxes, but I guess the manual does its best to try to separate out what those categories could be. Having said that, though, it's very common that people might have some symptoms across multiple of the diagnostic categories. People can have more than one type of eating disorder at the same time as well, and that profile can change over time as well. And it's interesting, I would say probably a couple of the most commonly known eating disorders, for example, anorexia, which involves a lot of food restriction and tends to have that stereotypical, I guess, picture for people of what an eating disorder might look like. It's actually one of the less common eating disorders, same as bulimia, where people will sort of engage in patterns of sometimes restricting, but then particularly sort of consuming large quantities of food and then finding ways to sort of expel that food food in different ways. It's also one of the less common ones. The most common eating disorders in Australia are what's called unspecified feeding and eating disorder, and that's where the disorder, the symptoms, it just doesn't neatly fit really into any of the boxes, but it still causes, significant distress, significant impairment, and significant medical and physiological and psychological risk. And the other most common disorder in Australia is what's called other specified eating disorder, and that's where it really closely resembles, for example, bulimia or anorexia or one of the other disorders, but it doesn't quite meet some of the diagnostic criteria. And then binge eating disorder is the third most common one in Australia. And then there's a few other less common types, which is probably becoming a little bit more well known, which is called avoidant and restrictive food intake disorder. And that's it's interestingly usually a little bit different to the other disorders, where it's not necessarily driven by those beliefs or concerns around body image or sort of body shape or size. It's often might be more to do with sensitivities or other reasons that are making it hard for the person to kind of eat in a healthy way.
And so you touched on there some of the misconceptions or perhaps myths surrounding eating disorders, such as what a person might look like, or that we can tell if someone has one of these conditions by looking at them, or that the ones that come to mind immediately, like anorexia or bulimia, are actually not the most prevalent. Are there any other, perhaps Jo, you could get us started with this. Are there any other myths or misconceptions that you'd like to take a moment to debunk here for us?
Oh, I don't think this is a super common myth. Maybe it's a misconception, but I remember at the very beginning of my recovery journey, I felt a lot of shame for having developed eating disorder, and it was shame and it was also embarrassment, because I thought that I was quite educated, I was finishing my uni degree. I just sat and thought, how could I'm too smart to have developed an eating disorder. I was aware of it before. I knew what anorexia was. I'd been told to, it was something that should have been avoided. And I just remember thinking, how has this, how have I developed this eating disorder? I should have been, quote unquote, better than this. So I think that was a misconception for me personally, is that it's something that only happens to a certain group of people. It happens to so many different people across so many different groups in society. And yeah.
Sarah, would you be able to speak to that a little bit as well? The fact that, in fact, eating disorders affect a really broad range of people and aren't limited to particular demographic groups.
That's right. I think Jo's experience is a really common one. I think that myth around what somebody with an eating disorder looks like or their situation in life, we just know that that's not true. We know that eating disorders don't discriminate. We also know that you cannot tell if somebody has an eating disorder by looking at them, and there can be a lot of stigma, say for people who might be in a larger body. There's a lot of shame and stigma around, again, thinking that it can't be happening to them because they don't meet that stereotypical profile of what society tends to think of. I guess having said that, there does tend to be some greater incidents for certain groups and also certain times of life. So, for example, women do tend to experience eating disorders at about twice the rate that men do. Again, it's an estimate, but we do know that there can be also a lot of shame and stigma for men, and so it could also be that people identifying as male may be less likely to come forward and engage in help as well. And again, partly there's that stereotype that eating disorders only affect young females, and again that can make it harder to reach out and help seek. We also know around a quarter of people with eating disorders are under 20, so that adolescent and sort of young adult period is a time of greater vulnerability. And there are, I guess, certain groups in the community who, again, may be more vulnerable, and so that includes people who identify with an LGBTIQA plus sort of background. People who are neurodivergent also tend to have quite a significantly greater risk of eating disorders, and also health conditions that have quite a strong or rigid focus around food and eating and weight, like diabetes, for example. We know that people can be more at risk. And I guess any time in life where there's either quite elevated stress and or physiological changes, so menopause, pregnancy, adolescence, those are also times where that risk can become elevated.
Thank you for elaborating on those. There's a few interesting points that I'd love to expand on a little bit. So something that you mentioned, Jo, was the idea, without articulating it as such, the idea of self-stigma. I think we are quite familiar with the concept of stigma by now. Research into stigma and into things that can contribute to it has been around for at least 70 years or so. But the concept of self-stigma is perhaps a little bit less well known. And I think in my experience, it's very much the idea that you internalize these beliefs about the condition that you have been labeled with. And regardless of whether or not that is your experience, it's almost as if you start to tell yourself that it's your experience. It is what you've gone through because of this label. Of course, the label can be quite helpful though as well, because it can enable you to then seek the treatment that is going to be helpful. So I just wanted to expand on that. But also, Sarah, you were talking about the broad range of people that can, of course, experience an eating disorder, but the fact as well that there is higher incidences in some groups. Is there much research on this subject, or is there much known about why a person might develop an eating disorder?
Yeah, look, there is a lot of research happening, and it's continuing to evolve and emerge over time. Because of the complexity of eating disorders, there's no one single cause, and it's thought to be a combination of genetic risk factors, psychological, biological, and also social risk factors as well. We do know that there are certain traits which are thought to have a genetic basis, things like perfectionism and avoidance, rigid thinking styles. Those can put people at greater risk. Also, as Jo mentioned before, if self-worth is really focused on body image and body shape or size, or if self-esteem is low, again, those can put people at greater risk. And people who do engage in dieting behaviours and have body dissatisfaction can also be at much greater risk. And there is pretty strong evidence for that genetic component, but it's sort of thought to be unlikely to relate to a single gene, but just probably a complex interaction of multiple genes. And I guess all those things combine and lead somebody to be vulnerable to that eating disorder developing.
And given that there are so many factors to consider, what might be the first steps in terms of initiating somebody's recovery journey or making that first step into an intervention? Would it be more along the lines of psychotherapy, or would we see something more along the medical kind of biomedical model of medications and those kind of treatments?
Yeah, it's an interesting question. I guess the best approach is thought to be what's called a stepped care approach. So that sort of recognises that people will kind of be at different maybe levels of severity, if I can use that word. But I guess if people don't get the right support, that's when that severity and that impact can sort of keep increasing over time. So if people are just maybe starting to become at risk, then sometimes some self-help or I guess what we might call a lower level intervention, peer support, community support, family support can be really helpful. But then if the eating disorder symptoms are starting to worsen, that's where we'd be wanting to recommend that multidisciplinary care team approach. So often a GP might be the first point of call. They can then start to explore some of those physical aspects. And then in Australia, GPs tend to be the main almost gatekeeper of the Medicare system, and so people can actually access some rebated eating disorder treatment sessions under Medicare. So the GP is often the person who might help them get that process started. And then again, it depends, it's based on the person, their preferences, their needs, the particular kind of presentation and symptoms that they have. That would then inform the decision around what sort of psychological therapies might be helpful, what sort of other physical therapies or assistance, and there's also some complementary therapies. But it's thought to, as much as possible, have people in the least invasive care approach aligned to their needs. And I guess sometimes people might be admitted into hospitals for those medical and kind of, I guess, weight stabilization reasons. But a lot of feedback is that often that's not necessarily feeling like a very positive experience for people, which is so understandable. So I guess it's really trying to be person-centered and be guided by the person as to what they need and want.
Absolutely. Joanna, would you mind telling us a little bit about what worked for you in your recovery journey?
Yeah, so my recovery journey really started with a trip to my GP. And it was an interesting trip in that my eating disorder had started kind of manifesting in my mind, and a really big part of me, well, the eating disorder part of me, really didn't want to seek help. I wanted to continue with the destructive behaviors that my eating disorder was propelling me to do. But there was this part of my brain that was just like, no, this isn't normal. This isn't going to help you in the future. You have no energy. This is consuming all of your thought and all of your time. You can't think of anything except for how you look and what you're going to eat next. So the first step was to book in with my GP, and I was really thankful that I had a great relationship with my GP. I went in, I told her how I was feeling. To be honest, I think about 80% of that first GP appointment was me just crying at my GP. I really didn't know what was going to happen next. I was terrified of going to hospital, and she was amazing. She talked me through what my options were. She got me in contact with a great government organisation in Western Australia called the Centre for Clinical Interventions. She put me on their wait list, and she really encouraged me to go see a psychologist at university, because obviously as a student, didn't have a lot of cash spare. So yeah, that was a really great starting point, and it was also just really nice to have someone tell me that the way that I was feeling wasn't normal, and that I could get better as well. So that was the first step. GP saw my psychologist at university. The issue with seeing a psychologist at university is that they are covering so many different students with so many different concerns. So you really do want to talk to someone who has an eating disorder background, which is great. When I started at CCI, it was once a week with a great therapist, and yeah, it was a slow process. I think it took about, I had 2 intakes. The first intake took about 8 months, and then had a bit of a break. A couple of years later, I actually went to London for a couple of years and worked, came back, saw my GP again, and she just kind of asked me a couple of questions about eating and my body image, and she actually recommended that I go back to CCI, which I did for another 6 months. But it was maybe like once every 2 weeks I would see my therapist, and it was the best thing I've ever done. And yeah, coming out of that, I was connected with a psychologist who specializes in the eating disorders. And then I worked with her really to figure out why I developed an eating disorder in the first place, and how I could build up strategies and look at my self-worth and build it up for the future. So I feel like I'm really in a position now where I have a really strong sense of self, really strong self-esteem. I'm really looking forward to the future. I love my life. And yeah, it took a long time. I think the first, I must have been 22 when 21 when I sat down with my GP in that very teary waiting room. And I'm now 29, about to turn 30. And yeah, it took a while, but it's worth it.
That's great to hear. I'm really pleased to hear that you're doing so much better and are so excited about the future. Do you have any advice for somebody that might be experiencing an eating disorder or feels that that might be something that the symptoms are sounding familiar to them? Is there anything you'd suggest for someone to do?
Yeah, so to echo on what I was saying before, book in with a GP, and take your time as well. If you don't have a great relationship with your current GP, have a look around, do a bit of research, try and find a GP who has a background in mental health. And yeah, even if you feel, quote unquote, stupid for seeking help, or you think that you're overreacting, I think that's actually the word that I was looking for. If you feel like you're overreacting and that this isn't actually that big of a deal and I just need to get just need to get it together, I think that's a sign that you definitely do need to go see someone and chat through it. So that's definitely the advice I would give. I think the other advice I would give is sharing what you're going through helps so much. But that being said, it is so difficult to tell people at the beginning. I was so fearful. I was ashamed. I was embarrassed. I was entering the workforce for the first time. I started by telling my GP, and I told my psychologist. I think the next person I told was my boss, because it was really, what I was going through was really impacting my ability to perform at work. And she was amazing. She was so understanding. She was so supportive as well. And I think just the more you open up and tell people and share what you're going through, the easier it is. And everybody wants to help you. Everyone wants to support you. And yeah, it's the more you share, the less the burden is at the end of the day.
Yeah, I think that's really true. And thank you so much for taking this time to share with us, bearing in mind that it is really helpful for people to hear the personal stories. But I think you're really right in saying that it can be pretty intimidating and takes a lot of courage, I think, to open up and to bypass that shame, that embarrassment, that fear that I think a lot of people do experience when they realize that what they're going through is actually not necessarily what everybody else is going through. In fact, some research has suggested that anorexia in particular does have or has had, at least in the past, the highest mortality rate amongst people with a mental health condition. Is that a statistic that you've come across, Sarah, or is that something that you would find believable?
Yeah, that our sort of data and our research indicates the same thing, that like in general, eating disorders do have one of the highest mortality rates, and anorexia in particular is considered to have the highest mortality rate of all mental illnesses, which I think does make sense again when we think about that complex interaction between the psychological health and the physical health. People with eating disorders, and it's even more amplified in people with anorexia. There's just so much physical health complications and physical health risk and danger that can go along with that. And I guess the longer that somebody sort of goes into or is moved into the depths of that eating disorder, and the more severe all of the thinking and behaviour becomes, those medical risks, can lead to death. The other part of it is that there does tend to be quite a significantly elevated risk of suicide for people with eating disorders. And again, it's more amplified for people with anorexia. So I think those two things combined, and I guess that's what highlights as well the complexity of an eating disorder, where when the body is kind of not having just the health and nutrition that it needs, the brain can't function in the way that a healthy brain does. And so it just further amplifies how hard it is, to make those changes, especially on your own. And there was so much of what Jo said that just really resonated with me about the value of connection, connected with, the right professionals who have that expertise and knowledge. And, we know that shame thrives in secrecy. So it does take so much courage, but taking those steps, sharing it, being received in a non-judgmental and compassionate way just starts to help chip away at that shame and that voice of the eating disorder as well.
Yeah, that statistic is one. So where I found that statistic, it was from a research paper from 2011, but by the sounds of what you're saying, not much has changed in the last 15 years. Yeah. Perhaps I'm wondering, though, if some of the alternative or complementary treatments have changed in, say, the last 15 or 20 years. Are we seeing the emergence of maybe new treatments?
Yeah, look, there are some new treatments coming around, which I guess anytime there's innovation in treatment, it can bring some excitement. But then just wanting to balance that to make sure that the research is robust and, wanting to minimize any risk of harm for people. But there are some interesting physiological treatments that are kind of being tested at the moment, including some down in Melbourne, and really just looking at that really strong genetic and physiological component to help directly help make changes in the brain. And there is some quite positive early data emerging from some of those things. There is also some emerging data around equine therapy, so therapy with horses, which is interesting. There's again, it's emerging, so we wouldn't say it's evidence-based yet, but that's quite interesting. And then also in the psychedelic assisted therapy space, I believe that that's starting to explore that in relation to eating disorders as well.
Very interesting to hear. Yeah. Hopefully there'll be some more data that we can draw on soon in those areas. So Jo, maybe if we just come back to you for a moment, is there any so we've talked about what advice you'd give to someone who might be experiencing an eating disorder, but what about to somebody who is perhaps a carer or a friend or a family member for somebody who's having that experience? Is there anything that you can share that would be helpful for them to know?
Yeah, sure. Well, I can try. But I think first and foremost, when you're watching a loved one struggle, well, not struggle, again, sorry, I'm still trying to get my terminology right. But when you're watching someone that you love go through an eating disorder, it can be quite confronting, especially if you don't know too much about eating disorders. But it just comes down to seeking out information around eating disorders. The Butterfly Foundation is amazing. They've got some excellent lived experience stories. They have, I believe, they have some workshops and webinars for carers as well. And if you're listening to this podcast as well, congrats. You're learning a little bit more about eating disorders and everything they entail. I suppose in supplementary to just getting a bit more educated and informed on eating disorders, I think it's really important to remember that your loved one isn't just their eating disorder. There's so much more going on in their life, I'm sure. And I think it's really important to remind them that there's still so much joy and happiness and excitement in the world and in their future as well. So ask them how their job's going, go on a walk, sit down and chat to them, see what's on their mind. I think I found it quite helpful when I was going through my eating disorder when people actually wanted to talk about it and explain, or they wanted to know what I was learning in my recovery journey as well, because there is so much information that you were presented with and it is quite eye-opening. So it was really handy for me to have some friends sit down and just ask what my recovery journey was like. That being said, I'm sure some people prefer to maybe go through it privately and they're not quite ready to share at the beginning. The other thing I would say to carers is try and discourage as much negative self-talk as you can. I think I was, again, at the beginning, I was very apologetic for my eating disorder. Again, I remember when I sat down with my boss at work, I think the first thing I said was, "I'm so sorry, but I've been diagnosed with an eating disorder." And like, I felt like I was an embarrassment to her and her team. But the first thing that she said was, this is not a fault. This is not a flaw. This is something that you were going through, and you were so much more than than this disorder. So I think, in summary, I think if you're a carer or a friend or a family member of someone who's going through an eating disorder, get out there, get curious, learn more about eating disorders. The second thing would be, talk, remind people of all the amazing things the world has to offer. Get interested, ask questions, and just try and help them remember that they're an amazing human at the end of the day, and the world needs them.
That's great. Thank you so much for sharing that. Those suggestions, bearing in mind that you're coming from the lived experience position rather than as the carer or the friend necessarily. It's really helpful to hear that you actually did want to talk about it. I'm sure different people would have different preferences. But I think the more that we, as we said before, the more that we can share and try to understand what people are experiencing as well as what's helpful for them, that seems like it will make a huge amount of difference. I also noticed that you hesitated around the word struggled, because perhaps that's characterizing the condition as one that's necessarily only negative. Do you mind if I ask if there's a particular reason why you feel like struggle is not the right word, or what word you could replace it with?
Yeah, I think struggle and suffer are two words that I'm really trying to work out of my vocabulary at the moment, because it was difficult to go through recovery, but I really do see it as this amazing catalyst for self-growth on reflection. And also, I feel like we don't say, you struggle with a broken leg. You had a broken leg and then you got through it and you recovered. And the same thing, you didn't suffer with a broken leg, you had a broken leg and you got through it. So I think for me, being able to see my eating disorder as it was a medical issue. It is not a personality flaw. That's been really helpful for me in the last couple of years.
Yeah, sure. Thank you. Thank you for clarifying that. And maybe to finish up, Sarah, so we've heard from Jo around what is helpful for maybe people close to somebody to know. What do you think it would be helpful for the public to know about eating disorders in general?
Yeah, I think that the more we can break down stigma, the more we can help people be as educated as possible. Again, to reiterate what Jo said, that it's a condition. It's not a personal weakness. Again, we don't judge somebody for having a heart condition or, so just really trying to reframe it. It's something that people do need, hopefully, professional support and treatment around. And I think as well, what's really important is, there's so many things that can fuel an eating disorder and leave people vulnerable, but we do think that one part is particularly the Western societal cultural focus on what's called the thin ideal and having a certain body shape or size in order to be considered beautiful or attractive or whatever, all those words. So the more that we can hopefully all just start to break down that myth and work towards our own body acceptance. We're just all in our own vessel. We didn't choose it, but we're here. Our bodies do amazing things for us. So the more we can accept our own body, accept other people's body, just try to take away that judgment and recognize that we're so much more than just a body, and our body does so much for us, every minute, every second. And just being really aware of our own, we're all raised in society. We've all got our own unconscious biases and stigma around things like weight and shape and size. So just really being aware of our own attitudes and behaviors and just really trying to develop as healthy attitudes and behaviors around food and eating to kind of role model that for people who might be at risk.
Absolutely, yeah. I think our Western beauty ideals probably have a lot to answer for. Of course, never the sole cause, though.
Yeah, absolutely.
Yeah, so there's a huge amount of information on the Butterfly Foundation website. I've had a look, and you've got your own podcast. You've got resources that break down some of the myths, some of the misconceptions. I know that the 2nd to the 8th of September, so earlier this month, was the body awareness week. Sorry if I'm getting that name wrong, but a week kind of
close.
dedicated.
Yeah.
Are you able to correct me?
Body image and eating disorder awareness week.
Body image and eating disorder awareness week. Thank you. I knew it was very long. Yeah, fantastic. So just raising awareness is a really good starting point. And also, I think it sounds like being cautious of the language that we're using, being aware of the language we're using, being aware of how misconceptions and stigma might be influencing people, and just really allowing people to take that first step towards maybe seeing a GP, or maybe whatever it is that they need to do, if it's peer-based work or if it's more counselling based. And yeah, a huge amount of information and resources on the Butterfly Foundation website. Is there anywhere in particular, or anywhere else you might point people towards if they did want to get some more information?
Yeah, there are also some great state-based organisations. So, for example, Eating Disorder Victoria has a lot of information, and also support services as well. Eating Disorder Queensland. Yeah, I think going to reputable sources, and I guess when trying to find a health professional, using databases to actually find people who have that specific experience. There's a Butterfly referral database. I think a couple of those other organisations have a database as well, NEDC, for example. So yeah, just really trying to find the right people, because unfortunately, I guess health professionals can carry their own stigma and bias, and unfortunately sometimes perpetuate some of that unhealthy focus on weight or shape. So the right support really can help make that recovery possible.
Absolutely. I think that's a great place to finish today. Thank you again so much for your time. We really appreciate hearing from the professional perspective and also from the personal perspective, and hopefully our audience will get something out of the really valuable information that you were able to share with us today. Any final thoughts or words before we sign off?
Yeah, I might just, I suppose my parting words for anyone out there listening who might be at the beginning of their eating disorder recovery journey. It will be exhausting, unfortunately. It could be quite lengthy as well, but it is so worth it on the other end. It is so amazing to be able to live my life really at the fullest, and to really honestly, truly 100% say that I love my body and I love what it allows me to do. And yeah, I think if there's any hesitation in your mind as to whether or not you should seek out help, definitely make that first step. Go talk to your GP, go talk to someone that you love, get curious. It is amazing on the other side, guys. Come join me. We'll go roller skating and we can talk all about it.
What's not to love? Roller skating, yeah. I mean, that's so fantastic to hear you say that you 100% love your body. It's really, really great to hear from your lived experience perspective, and it demonstrates the power of peer work, or hearing from a person who has actually gone through the experience that we're talking about. Thank you, Joe. Thank you, Sarah.
Thanks, Djuna.